Welcome to the Windsor-Essex County Health Unit Naloxone Administration Client Training. In terms of our local data for opioid overdoses, in Canada, there were 5,368 apparent opioid toxicity deaths that occurred between January and September 2021. This is approximately 20 deaths per day. For a similar time frame in the years prior, there were between 7 in 2016 and 12 in 2018 deaths per day. 74% of deaths were among men. For both men and women, the majority of deaths were among individuals aged 20 to 59 years. Opioids were responsible for 48 deaths in Windsor-Essex County in 2019, which has only intensified as our region observed 61 opioid-related deaths in 2021. Opioids belong to a group of drugs called depressants that are primarily used to relieve pain. Opioids can be prescribed by a healthcare professional or obtained illegally. Opioids can also produce a feeling of euphoria or relaxation, which creates the potential for them to be misused. Both legal and illegal opioid use can lead to addiction and overdose. Examples of opioids include oxycodone, morphine, codeine, heroin, and fentanyl. Opioids can also be found in non-opioid street drugs, such as cocaine. An opioid overdose is a medical emergency which occurs when a person takes a drug or a combination of drugs that is more than their body can handle. The brain can no longer control basic life functions such as regulating body temperature, breathing, heart rate, and consciousness. Anyone can overdose whether they are a first-time user or a long-time user. There is no exact formula to predict how much of a drug will lead to an overdose. Not everyone who overdoses will die, but if it is not treated quickly, the lack of oxygen to the brain that can occur during an overdose may cause serious consequences. The signs of an opioid overdose include not being able to respond. The person is not moving and you cannot wake them up with stimulation such as yelling or a sternal rub. A sternal rub consists of using your knuckles to vigorously rub the center of the chest. Their breathing is slow or absent. They may be making snoring, gurgling, or choking sounds. They may have blue fingernails and/or lips. They may have cold and clammy skin, or their pupils may be tiny. Naloxone nasal spray, otherwise known as Narcan, can reverse opioid overdose symptoms and improves breathing. Naloxone starts to work within 2 to 3 minutes of administration. Naloxone nasal spray is given into the nostril, which allows for fast absorption into the bloodstream. A person does not have to be breathing for naloxone to work. Before administering, check to see if the person has a medical bracelet identifying an allergy to naloxone. If you don't know if the person is allergic, still administer naloxone. Naloxone effects may last 20 to 90 minutes. Naloxone only works if a person has opioids in their system. Giving naloxone to a person because of a non-opioid overdose is unlikely to cause more harm. For someone who has used an opioid, more than one dose of naloxone may be required. It may be possible that the signs of an opioid overdose return after a dose of naloxone has been given and worn off. Naloxone may cause withdrawal symptoms such as nausea, vomiting, pain, sweating, agitation, shivering, goosebumps, and fast heart rate. These symptoms will diminish as the naloxone wears off. Possible side effects include nasal swelling, congestion or runny nose, headache, increased heart rate, increased blood pressure, or dizziness. However, the benefits to administering naloxone still outweigh the risks of an overdose. The naloxone nasal spray kit includes 2 doses of naloxone nasal spray, each providing a single 4 mg dose, an instructional insert, the 5 steps to respond to an opioid overdose, a client identifier card, a rescue breathing barrier for CPR, and a pair of non-latex gloves. It is very important to remember, do not test the spray. There is only 1 dose per package. Don't prime or test it. Evidence shows that witnesses to an overdose often do not call 911 for fear of police involvement. Therefore, the Good Samaritan Overdose Act protects people from being charged by police for seeking medical attention when someone has overdosed. It's okay to stay, help, and administer naloxone. There are 3 steps to take care of your naloxone kit. Step 1, keep it cool and with you. Store in a cool, dark place between 15 to 25 degrees Celsius. Do not freeze it and protect it from light. Keep it with you if you or someone you know is using. Step 2, check your kit. Routinely check your kit to make sure it contains all of the supplies. Check the expiry date to ensure it has not expired. Step 3, tell others. Tell your friends and family where you keep your kit in case of an emergency. The 5 steps to respond to an opioid overdose are: Step 1, shout and shake. Step 2, call 911. Step 3, give naloxone. Step 4, perform chest compressions or start CPR if you are trained. And Step 5, check if it is working. Let's take a deeper look at the 5 steps. Starting with Step 1, shout and shake. Try to wake the person by shouting their name. Say, "Hey, are you okay?" Or shake their shoulders. Rub in the middle of their chest with your knuckles, or try pinching their earlobe. Check if the person is breathing. Is their chest or stomach rising and falling? Place the back of your hand over their mouth. Can you feel breath? If they are breathing, place them in the recovery position and monitor them. Step 2. Call 911 if the person is not responding and lay them on their back. Even if they wake but something still seems off, get help and call 911. If there are other people around who are able, ask one person to call 911 and come back to tell you that they did, while you stay with the victim. Have another person get the naloxone kit. Do not leave the victim alone unless you must to get help or it is dangerous for you to help. Speak calmly and clearly. Inform the 911 operator that the person is not responding and where you are. When EMS arrives, tell them what you know about the drugs the person took and how much naloxone was given. Step 3. Give the naloxone. There will be 2 naloxone nasal sprays in your kit. First, open the packaging, then hold the device with your first and middle fingers on either side of the nozzle and your thumb on the bottom of the plunger. Do not test the spray. There is 1 dose of naloxone per device. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into the nostril until your fingers are against the bottom of the nose. Press the plunger firmly to give the dose of naloxone, then remove the device. Step 4. Perform chest compressions or start CPR if you are trained. To start chest compressions, place the person on their back on a hard surface. Find the middle of their chest and lock your arms in front of you. Push hard and fast with both hands at least 2 inches down with each compression. Or start CPR if you are trained using the barrier mask in the naloxone kit. If you are not comfortable with chest compressions and rescue breathing, ensure that you have called 911, administer naloxone every 2 to 3 minutes, alternating nostrils with each dose until the person responds, and place them in the recovery position until EMS arrives. Step 5. Check if it is working. If naloxone works, the person will start to respond within 2 to 3 minutes. Continue with compressions until they respond. If the person does not start breathing within 2 to 3 minutes, repeat steps 3 and 4 until the person responds or EMS arrives. Use a new nasal spray device and give a second dose of naloxone into the other nostril. Naloxone can be administered every 2 to 3 minutes. Alternate nostrils to decrease the risk of adverse reactions. The person may not be responding to the first dose because they may not have used an opioid, they could be experiencing a different serious medical issue, or a higher dose of naloxone may be needed. When the naloxone starts to work, the individual may wake up slowly or suddenly and they may be disoriented. Lay them on their side in the recovery position and provide emotional support. Explain what just happened and how it's important that they be seen by a healthcare professional. Naloxone is not a substitute for emergency medical services. Encourage them not to use more drugs in the next few hours to avoid another overdose. Watch for signs of an overdose returning as the naloxone wears off, and stay with the person until EMS arrives. Naloxone is available without a prescription or a health card and at no cost from a number of local pharmacies. Additionally, a variety of local organizations also provide naloxone kits to clients at no cost. You can visit www.wecoss.ca to view a list of pharmacies and locations. These locations also provide naloxone training before you receive a kit. Thank you for viewing the Naloxone Administration Client Training.